Today in Health IT, we're going to take a look at the ONC through history. It's their 20-year anniversary. And we're going to, we're just going to look at historically what they've been able to do and maybe have a few comments on that. My name is Bill Russell. I'm a former CIO for a 16 hospital system and creator of This Week Health, set of channels and events dedicated to transform healthcare, one connection at a time. We want to thank our show sponsors who are investing in developing the next generation of health leaders, notable ServiceNow, Enterprise Health, Parlance, Certify Health, and Panda Health. Check them out at thisweekhealth.com/today. All right, you can find this and every news story we cover at thisweekhealth.com/news. Check it out today. And then one last thing, share this podcast with a friend or colleague. Use it as a foundation for daily or weekly discussions on the topics that are relevant to you and the industry. A form of mentoring. They can subscribe wherever you listen to podcasts. All right, today we're going to look at the ONC and the history of the ONC. 20 years ago in April, the Office of National Coordinator for Health IT was created by Executive Order 13335. I'm sure you needed to know that. If, in case there's ever an ONC trivia game, you'll know that answer. It was signed into existence by President George W. Bush in April of 2004. As we said, ONC was established within the Department of Health and Human Services, HHS, and charged with fulfilling its responsibilities consistent with a vision of developing a nationwide interoperable health information technology infrastructure. Think back to 2004. Man, it's hard to think back to 2004. We're coming out of the Y2K stuff. I guess AOL is still around, and that's an on-ramp for a lot of people to get onto the information superhighway or the internet. And it's very early on. I wouldn't say early on in the technology cycle, because the technology cycle had developed pretty rapidly in a lot of other industries. But in healthcare, my gosh, 2004 was the age of paper. It was paper, it was clipboards, it was fill this out, we'll put it on a chart, we'll put a bunch of stickies on it, and we will put it into this special room for you when you come back to visit us again sometime in the future. God forbid you go to a different health system, in which case we have to take all those papers and somehow get those papers from one hospital system to another hospital system, where they will recreate that entire record, put it on paper, put those same stickies on it, and put it into their room. If you go to a third system, we repeat. And so that's what we were looking at back in 2004. And when the federal government looked at this, they said, my gosh, if healthcare isn't going to self-select technology on their own, we've got to do something to help to foster this and push it forward. So the Office of National Coordinator for Health IT is birthed. 2005, multi-million-dollar investments in health IT. The ONC has often looked for partnerships in public-private to drive things forward. And so they made some investments to bring people into the effort. 2008 saw the Federal Health IT Strategic Plan for 2008 through 2012. We should go back and look at that at some point. I should pull that up and see what it actually said. Sometimes looking at history will lead you as you prepare for the future. Like that plan that there might be a good plan to look at if you're thinking about how we approach AI. Because right now we might be making either the same mistakes, or we could be learning from that health IT strategic plan from 8 to 12 and say, hey, some of these things worked, some of these things didn't. So sometimes good to look at. Then you had the High Tech Act. Hard for me to say. I always want to put a T at the end of high tech. High tech. Anyway, it's the High Tech Act, Health Information Technology for Economic and Clinical Health. High Tech Act sought to modernize the healthcare system through widespread adoption and, here's the bad word, meaningful use of health information technology. Listen to these goals: to ultimately improve healthcare quality, which it has done. We can argue, and I have argued with physicians over this, but it has improved quality, and there's many cases of that. Reduce costs. That one we could definitely argue. I'm not sure which side I'm going to fall on that one. Reduce costs and empower patients to take more act. And we could argue that one too. Has technology really empowered patients? I don't know. Reduce costs? I don't know. Improve quality? I think we can make that case to take a more active role in their healthcare. The High Tech Act Also, importantly, established ONC in law and provides HHS with the authority to improve healthcare through health IT. So this is really where things start to take off. Money starts to flow. We have carrots and sticks for health systems that adopt an EHR as a platform technology for the medical record, and sticks, penalties for those who choose not to. And so we head down this path and modernizing American healthcare. Now we're in 2010. High-tech programs under the High-Tech Act. ONC launched several programs aimed at supporting nationwide implementation of health IT from different angles. These include the State Health Information Exchange Cooperative Agreement program that established health information exchanges in each state, regional extension centers that helped support small providers, health IT adoption, beacon communities that demonstrated how health IT advanced healthcare, and workforce development program that provided health IT education to medical professionals. Notably, the Strategic Health IT Advanced Research Project, SHARP, program supported the discovery of breakthrough research that led to the creation of the Fast Healthcare Interoperability Resources FHIR application programming interface focus standards that is enabling interoperability around the country. So a couple things they did here. Again, a lot of times it's, you don't know what you don't know until you start doing it. And so we implemented these state health information exchanges, and it provided this meshed framework for sharing information locally, which is really important, locally or regionally, which is really important. And I really could make a case it's the most important sharing of information is local and regionally, because invariably, if you're going to a health system, one health system, and there's a specialty that they don't have, and they're going to send you to another, they're going to do that regionally. At least today, that's what happens in a majority of cases. You're moving around regionally. I know that there's other cases, there's complex cases where you're traveling from state to state and whatnot, but those state and regional at the time of 2010 made some sense to put in place. Now, what we found is that keeping the funding, which one thing to stand them up with funding, it's another thing to keep them operating with funding. And that became a significant challenge. The other thing that became a significant challenge was helping them to be effective. That is, the information coming in from all these various sources were not standardized. So we didn't have standard information. So when it came in, garbage in, garbage out, we had trouble creating this comprehensive or longitudinal patient record, if you will, but this comprehensive patient record, at least at a regional level. So you keep progressing this forward to trying to do it on a national level, and you realize, wow, this program maybe wasn't as well conceived as it could have been. A national program may not have been received real well back then. Times change. People, the time at which things happen does matter. And it does speak to why certain approaches are taken versus others. Advancing electronic health records, ONC health IT certification and start of meaningful use happens also this time frame. That's 2010. Standard and interoperability framework, S&I framework. ONC launched the S&I framework as a vehicle to convene the health IT community and rapidly prioritize health IT challenges, and subsequently develop and harmonize standards, special specifications, and implementation guidance to solve those challenges. ONC was also responsible for curating the set of standards and specifications that supported interoperability, ensured that they can assemble into solutions for a variety of health information exchange scenarios. Okay, so these are all the things that are happening around MU. The thing that happened in MU was unintended consequences. You had people sprint off and make the money, but did not think about the long-term impact of the EHR and the decisions they were making around building the EHR and the data standards. We did not put data governance in place prior to doing this, and therefore we ended up with a mess. So there's a bunch of unintended consequences with regard to how we implemented this technology. And there was also unintended consequences. There was fraud, quite frankly. There was a ton of, anytime there's a ton of government money that flows out, there's the potential for fraud that needs to be taken into account, and a bunch of EHRs that came into existence to rake in the meaningful use dollars did not live up to the, let's say, standards that were required either for their health systems that they were serving or for themselves. And so there was a bunch of not lawsuits, but there's a bunch of fines that were levied much later, but they were levied nonetheless. I think there's some other unintended consequences in this, and probably somebody with a clinical background with an MD in their title could talk more specifically to these. But over the years, you heard of various things that, quite frankly, from a clinical setting, we added an awful lot of burden onto the clinical staff. Cognitive load was increased on the clinical staff, making them more prone to make mistakes because there was so much documentation, so many other things that they had to worry about. Plus, we had to train them all on these systems. So there was an awful lot of load from that perspective. Anyway, so you get the idea. 2011, Federal Health IT Strategic Plan, 2011 through 2015. Again, good to take a look at some of these things, see what we learned, what worked, what didn't work. 2014 edition final rule. So 2014 edition final rule adopted important certification criteria that enhanced standards-based exchange, promoted EHR safety and security, enabled greater patient engagement, introduced greater transparency, and reduced regulatory burden. Maybe not to the extent that we would have liked, but that was the final rule. 2014, 10-year vision to achieve interoperable healthcare infrastructure. So in 2014, hey, we're at the end of this. So this 10-year vision would be interesting to look at as well. The ONC's 10-year vision for interoperable health IT infrastructure aimed to improve information exchange among healthcare providers, enhancing care coordination and patient outcomes. It provided a roadmap for stakeholders to work towards a more connected and efficient healthcare system, fostering innovation and collaboration in the industry. So that was the 10-year vision. How are we doing? How have we done? If you look at this, there's an awful lot of things that worked and did not work. A shared nationwide interoperability roadmap was released in 2015. You had the Federal IT Strategic Plan 2015 to 2020. 2015, you had the Information Blocking Report to Congress, which of course leads to the 2016 21st Century Cures Act. We had an awful lot of things that transpired from 2016 to 2020, but we finally have the Cures Act final rule that's published in 2020. And now we get to today's interoperability framework, which is TEFCA. That gets published in 2022. The first QHINs get established in 2023, and we begin implementing TEFCA. And what are they doing now? There's a lot of things they're doing now. They have the Common Agreement 2.0 is coming out, and then they have the HTI-1 final rule implementation provisions for the 21st Century Cures Act, and makes updates to the ONC Health IT Certification Program for algorithm transparency. So we're looking at algorithm transparency in the age of AI and governance around that. So a lot of things happening in the ONC. I would love it to review some of those things. I might go back and take a look at them and see what did we learn and what's in those provisions, and have we learned, especially as we go into AI, do we have the right foundation set? All right. That's all for today. Happy anniversary, ONC. Don't forget, share this podcast with a friend or colleague. Use it as foundation for mentoring. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health leaders, notable ServiceNow, Enterprise Health, Parlance, Certify Health, and Panda Health. Check them out at thisweekhealth.com/today. Thanks for listening. That's all for now.